On March 23, 2020, with the deadly coronavirus reported in 167 countries and territories, United Nations Secretary-General António Guterres called for a global ceasefire to support a public health response. It was the first global ceasefire appeal since the agency was founded in 1945, in the aftermath of World War II. The fury of the virus illustrates the folly of war, Guterres said. End the sickness of war and fight the disease that is ravaging our world. On the ground, little changed. More than a dozen armed groups, from the National Liberation Army in Colombia to the Communist Party of the Philippines, initially endorsed Guterres' appeal, but most offers to lay down arms were either one-sided or did not culminate in a formal ceasefire agreement. UN Security Council resolution that July, which affirmed Guterres' plea, also went nowhere. By fall 2020, the idea of a global ceasefire, which, in all of world history, has never taken place, was off the table. On February 26, 2021, the Security Council tried another tack. It passed Resolution 2565, which less ambitiously but more pragmatically called for a sustained humanitarian pause in order to immunize the world. In this case, there were recent historical precedents. In the 1960s, representatives from the World Health Organization launched its intensified program to eradicate smallpox, focusing on countries such as Ethiopia and present-day Bangladesh, where the disease was endemic and where public health officials had to work around conflicts in order to bring life-saving vaccines to civilians. This triumph of public health diplomacy will have to occur once again, humanitarian professionals say, in order to bring the COVID-19 pandemic to an end. From Afghanistan to Myanmar, Nigeria to Azerbaijan, people caught amid violence and instability will need to be immunized. Public health experts fear that if conflict zones don't receive vaccines soon, these places could become hotspots for transmission and incubators for potentially dangerous variants of SARS-CoV-2, the virus that causes COVID-19. But hammering out temporary ceasefires won't be easy. The political situation is more complex now than in the past, in part because of the abundance of non-state actors like al-Qaida and the self-proclaimed Islamic State that control large swaths of land, and are not necessarily eager to give governments credit for vaccination campaigns. Additionally, public health officials say, vaccine hesitancy and other pressing needs threaten to sabotage vaccination efforts. In Afghanistan, where the Taliban has recently taken over, COVID-19 vaccinations have already slowed. Still, humanitarian negotiators are pressing ahead. That's the reality of our profession, that we never give up, said Katia Papagianni, Director for Mediation Support and Policy at the Center for Humanitarian Dialogue, a Swiss-based private diplomacy organization.